Lose weight the hard way or with the pen. The naked truth: a lot of people start the year with the same script. New calendar, new promises, same mirror, same clothes that almost close but not quite, and then comes the big question. Should I lose weight the hard way or just use the magic pen and be done with it? Apparently, if you don't lose weight the hard way, you're cheating. Meanwhile, obesity is a chronic disease, not a personality flaw. Cute logic, right? In this video, we're going to talk about exactly that dilemma. Trying to lose weight by sheer willpower versus using medication, especially the famous GLP pens. When does it make sense to try without drugs? And when does insisting on that become a very polite form of self-sabotage? By the end, you'll have a clear framework to decide what actually makes sense for you, instead of what looks good for other people's opinions. Let's start with the hard way. When people say, "I want to lose weight the hard way," what they usually mean is this: no medication that helps with appetite or metabolism. No cheating, just diet and exercise powered by willpower. Maybe a protein shake here and there, but nothing that sounds like a drug. But doing it the hard way does not mean doing it alone. You can have a nutrition plan, a training program, a therapist, a support group, apps, follow up, all of that, and still be doing it without weight loss medication. The problem is that many people interpret "on my own" as on my own and against myself. They try to do everything with zero structure, zero guidance, and zero support, and then blame themselves when it doesn't work. Let's get something straight. Long before the injectable pens existed, people did lose weight. You know someone who lost 20, 30, 40 kilos just by changing lifestyle, usually with a lot of suffering and a lot of trial and error. The difference is that back then we had fewer tools, fewer supplements that actually tasted decent, less understanding of systemic inflammation, less attention to sleep, stress, and mental health, and almost nobody talked about the brain as part of the treatment. Today, we know better. We know that what happens in your mind before and during a diet is as important as what you put on your plate. We know that chronic stress, sleep deprivation, and unresolved emotional issues can quietly destroy your best plans. We know that some people are not just a bit overweight. They have obesity as a chronic, non-communicable degenerative disease. So yes, you can still do it the hard way. But it should be the smart hard way, not the heroic self-punishment version. Let's talk about your mind for a moment. Before you do anything with your body, you already did it in your head every morning that you actually go to the gym. You went there mentally the night before. You imagined yourself putting on your clothes, leaving the house, training. The same is true for every diet you started and every diet you quit. There's even a concept called logotherapy, which in very simple terms is treatment through meaning and knowledge. When you finally understand what is happening to you, when you give a name to what you feel and see the pattern, your brain stops being your enemy and has a chance to become your coach. That is why content, psychology, and education matter so much. For a long time, people thought therapy is only for when you're broken. Today, more and more people see a psychologist as a kind of personal trainer for the mind. You might already have a personal trainer for your body at the gym. Having one for your thoughts is not such a crazy idea. Sarcastic truth: nothing sabotages a diet faster than a brain that secretly believes you will fail again. When you work on mindset through therapy, coaching, education, or structured content, you are not just motivated. You're building the mental structures that make it possible to start, to continue, and to start again when you inevitably slip. And that applies to both paths, with or without medication. So when does doing it the hard way still make sense? It makes sense when you meet at least some of these conditions. You have been above your ideal weight for a relatively short time, months or a few years, not your whole life. You do not have severe obesity with multiple complications. You have not yet done a serious, structured attempt with proper support, and you are mentally in a place where you can invest energy into learning the process. If that sounds like you, then yes, trying without drugs can be very valuable, not because you are proving your moral worth to society, but because you can learn a lot about yourself in the process. Your triggers, your routines, your relationship with food, your coping mechanisms. You discover how your appetite behaves when you sleep well versus when you don't. You notice which situations push you straight into emotional eating. You learn what kind of structure you need to stay consistent. That knowledge will be useful forever, with or without medication. Here is where sarcasm helps. If your idea of trying hard is spending the entire week on willpower and caffeine, sleeping 5 hours per night, hating every meal, and then blaming yourself when you binge on Friday, that is not effort, that is torture disguised as discipline. The goal is not to win an imaginary medal for suffering. The goal is to build a system that works in real life. Now comes the uncomfortable but necessary part: the value of effort and the tyranny of time. People love to ask, is it worth trying without medication? The answer is, it depends, and it depends mainly on two things. First, How long have you been trying? If you started 1 year ago, got serious, learned a lot, improved your habits, and you're still not where you want to be, it may still make sense to continue refining your approach. 1 year of effort can be a period of learning, building habits, adjusting expectations. But if you have been on a diet since you were a teenager, and every year of your adult life has included, this is the year I finally lose weight, and you are still stuck, then no. It might no longer be worth insisting on the same strategy. Second, are we talking about simply being above your ideal weight, or about having obesity as a chronic disease? Obesity is not a fashion problem. Obesity is a chronic, non-communicable degenerative disease. That means it behaves more like hypertension and diabetes than like a bad haircut. It comes with metabolic changes that most people do not control just with willpower, no matter how much motivational content they consume. There is also a difference between having obesity and being temporarily above your ideal weight. You can have genetic and metabolic predisposition for obesity and still not be very heavy at a given moment. And you can be temporarily above weight without fully meeting obesity criteria yet. But the longer you stay with obesity, the more damage piles up to your joints, to your cardiovascular system, to your metabolism. So here is the question nobody likes to hear. If obesity is in the same category of chronic disease as hypertension and diabetes, why do we treat it so differently? Imagine telling a person with hypertension, look, you just need more willpower, throw away your medication and keep your blood pressure below 140/90 with discipline. Sounds insane, right? Or telling a person with diabetes, your blood sugar is high because you don't want it enough. Let's stop your insulin and your oral medications and focus on mindset. Nobody would accept that. But when it comes to obesity, many people still think it is acceptable to demand pure willpower and shame anyone who uses medication. This is where sarcasm writes itself. Apparently, for 2 chronic diseases we use science, and for the third we use guilt. Using medication to treat obesity is not cheating, it is treating a disease. Now let's talk about genetics and willpower. Yes, everyone has some level of responsibility for their habits, no. Not everyone starts from the same place. If you grow up in an environment with ultra-processed food everywhere, little sleep, high stress and no guidance, and on top of that you have a genetic predisposition toward obesity, your brain and your hormones will not behave like those of your friend who just eats less. Some people can overeat on vacation, gain a few kilos, and then lose them with 2 months of mild structure. Others fight hunger, cravings, and fatigue every single day just to stay in the same place. Calling that difference character, instead of biology, is not honesty. It is ignorance dressed up as moral superiority. Sarcastic translation. Your leptin, insulin, GLP-1 and brain reward circuits did not get the memo that you just need to want it more. This does not mean you are doomed, and it does not mean everything is genetics. It means that, for many people with obesity, willpower alone is not the right tool for the job. Or at least, it is not enough on its own, and this is where the famous pen comes in. What do the GLP-1 analogs and similar medications actually do? In simple language, they act on hormones related to satiety, appetite, and blood sugar. They help you feel full sooner, reduce the intensity of hunger, and improve glucose control in many people. That makes it dramatically easier to eat less without feeling like every meal is a battle. Studies suggest that, when combined with lifestyle changes, these medications can produce much larger and more consistent weight loss than lifestyle changes alone in people with obesity. Notice the phrase combined with lifestyle changes. The pen is not a magic wand. It does not erase the need to learn how to eat, how to structure your day, how to handle stress without using food as your only coping mechanism. If you take the medication and decide that this is your ticket to ignore sleep, movement, and diet forever, your body will eventually send you the bill, sarcastic version. If your long-term plan is, I'll just inject my way out of decades of bad habits and never change anything, your body is already rolling its eyes. So where does the pen fit? It fits where obesity is clearly present, where time has already passed, where you have tried sincerely and repeatedly to change without adequate success, and where the disease is progressing while you hesitate. Remember, in chronic diseases, time is not neutral. The more years you spend with uncontrolled blood sugar, the higher the risk of complications. The more years with uncontrolled blood pressure, the more damage accumulates. With obesity, it is similar. The longer you stay in that state, the more your metabolism, joints, and organs suffer in those cases. I will prove I can do it alone, even if it takes another 10 years, is not a noble statement. It is a dangerous one. There is another angle people rarely think about. Skin and aesthetics after weight loss. When someone has been overweight or obese for a long time, the skin stretches as you lose fat, especially if you lose it quickly. that skin does not always shrink at the same speed. That is why many people end up with folds of extra skin after major weight loss. In clinics that work seriously with weight loss, there is often a combined approach: nutrition, training, psychological support, and also dermatological or aesthetic support to help the skin adapt. The goal is not only to lose fat, but to have a result that the person can see and feel good about. Because let's be honest, if you lose a lot of weight but look in the mirror and only see loose skin, your brain will say, "What was the point?" Now imagine this scenario. You finally lose a lot of weight. You are in the rhythm with your diet and your training. Then you decide to do plastic surgery to remove excess skin. In a few hours of surgery, you get rid of something that bothered you for years. Great, right? Except that now you will spend weeks or months without training, dealing with pain, restricted movement, and a huge demand on your discipline to keep your eating under control while your usual tool, exercise, is off the table. Plastic surgery can be an excellent tool when well indicated and well timed. But it is not a magic ending. It has a cost in pain, recovery, and psychological strain. Pretending it is an effortless shortcut is another way of lying to yourself. So we come back to the central question: is it worth trying without medication? And the honest answer is, depends how you are doing. If you try to follow a plan, and you manage to stay on track most of the time, learn a lot, improve markers, and gradually move forward, then yes, it may very well be worth continuing the hard way for a while. If you can hold your diet for a week and then spend 3 weeks completely off, gaining back what you lost and more, then no, it is not working. You are accumulating frustration and time and disease, not results. In that case, a well-indicated medication, prescribed and monitored by a doctor who actually looks at you as a whole person, not just a number on the scale, can change the game. Not because the pen makes you a better person, not because it means you gave up, but because it finally aligns biology with your intentions instead of leaving you fighting your own hormones alone. So here is a simple framework you can use. If you have mild overweight, have not tried a structured plan yet, and are not dealing with long-standing obesity or serious comorbidities, it is reasonable to try without medication, using all the tools of modern lifestyle change, including mental health support. If you have obesity as a clear chronic disease, have been trying for years, and your health markers are worsening while you wait for a miracle from willpower alone, then it is reasonable, and often wise, to discuss medication with your doctor. In both scenarios, working on your mind is non-negotiable. Therapy, coaching, education, community, whatever you have access to. That is what will allow you to start, continue, and restart. Because even with the pen, you will need to decide what goes on your plate, how you move your body, how you cope with a bad day. Sarcastic but true. The pen can calm your hunger, but it does not cook your meals or take your phone away at midnight. And one more thing. There is no moral obligation to lose weight without help. Using medication to treat obesity is not a confession of weakness. It is a sign that you understand you have a disease and that time matters. Refusing help forever, to prove you can, might impress some people on the internet, but your pancreas and your arteries are not watching that show. So, should you lose weight the hard way or with the pen? Let me give you a more concrete picture. Imagine two people. The first has 10 extra kilos after a few years of stress and bad habits. No major health problems yet, no long history of obesity. This person has never really done a structured plan. They have only tried random diets from social media. For them, building a serious lifestyle program, food, movement, sleep, mental support, without medication may be a powerful first step. They will sweat, they will learn, they will fail and restart. But time is still on their side. Now imagine the second person. They have lived with obesity for 20 years. They have tried to lose weight more times than they can count. Every year there is a new last attempt that dies after a few weeks. Their blood pressure is creeping up. Blood sugar is flirting with diabetes. Their joints hurt. For this person, repeating the same approach to prove they can do it alone is not bravery. It is gambling with their future. Both people deserve respect. Both deserve empathy. But they do not need the same strategy. That is why comparing weight loss journeys as if everyone had the same starting point is useless and often cruel. Your path will depend on your history, your biology, your environment, and your current health. Anyone selling a one-size-fits-all solution is selling you a fantasy. So here is the answer. Lose weight in the way that actually gives you health, that you can maintain, that respects your biology and your history. Try the structured hard way if it still makes sense for your situation. And if time is not already working against you, use medication without shame if that is what your doctor and you decide is best for a chronic disease that has already taken too much of your time. Either way, stop negotiating with guilt and start negotiating with reality. You do not owe anyone a heroic story of suffering. You owe yourself a life that you can actually live. This content is for educational purposes only. It is not medical advice and does not replace a consultation with your doctor or a qualified healthcare professional. Medications for weight loss, including GLP-1 analogs and related drugs, must be prescribed and monitored by a physician, especially if you have other health conditions such as diabetes, heart disease, or hypertension. Do not start, stop, or change any medication based solely on an internet video. Talk to your doctor about your individual case.